So my background is social care and local government, workforce planning, workforce development, both for adult services and children's services. Just about everything I've done in the last few years has been done in collaboration with the NHS, and for the last 2 years I've been working for Health Education England in the West Midlands. So what I'm going to do is share with you my experience, first of all, of managing a programme called the Older Adults Workforce Integration Programme, which we're just in the process of doing the final evaluation for, but also a new programme which I'm now managing, which is called Integrated Care, and that's one of our transformation themes. You'll be very familiar, of course, with the context, and I know Steve in particular emphasised earlier the financial pressures that we should add to that. A couple of things there that I do want to emphasise that you may not be so familiar with. First of all, Framework 15, which is Health Education England's strategic framework. And the reason I mention that is that there's a great emphasis there placed on self-care, skills in self-care for people who use services, but also harnessing the potential for digital technology, technology-enabled care services, etc. And just final point there, whatever we do now in the West Midlands, we're working very closely with our colleagues in Better Care Fund programmes and also with the Vanguards. And now, of course, we'll be looking to the system transformation plans. I think we're at a point of transition, not quite a tipping point yet, but we're looking at moving away from an approach that's based on patients towards whole population health management, moving away from a focus on training and developing the NHS workforce, and moving towards looking at much wider public sector, private sector and voluntary services. So I think housing in particular are real key partners in the work that we'll be doing on integrated care. People, of course, live in places, not in organisations, so we need a much more of a locality focus to our approach to workforce development. And if we do that, I think we can also keep the skills, not necessarily within organisations, but we can keep skills and knowledge retained within the system. And I think also we're going to be moving from workforce plans that have been primarily focused on NHS workforce, which are used for education commissioning purposes, towards an approach which is an integrated system-wide workforce plan. Hopefully you're all signed up to that definition, because we haven't actually defined integrated care today. We adopted the one that was developed by, I think, local, personal and national voices. So integrated care is person-centred coordinated care, and that's reinforced by the King's Fund definition. Just to give you an idea of the range of partners that we've brought together, first of all in our older adults programme, and now with the integrated care programme, we're actually supplementing that with an even greater range of organisations and quite active involvement from the Vanguards. When we commenced the older adults programme, we did some best practice research. We looked at about 350 different examples of service integration nationally and internationally. These are our initial findings. There is a 100-page report. There's a 6-page exec summary, but I've tried to condense it very simplistically onto one slide. Just picking up the point about care coordination and care navigation. I'm not so much emphasising the role of people who are employed as care coordinators or navigators. What I think has become very apparent is that everybody needs to have those skills of care coordination and navigation, and that really is central to providing person-centred care. Okay. There's all sorts of different aspects to integrated working and integrated care. These are the ones that we've looked at. There are many more. Through our programme, we looked at principles of integrated working, which is a framework for working in teams, so that's something for everybody in teams, as well as the more specific work around care coordination and navigation, and some specific focus on the care home workforce, because I think often the care home workforce their role isn't particularly recognised in terms of their impact on the wider system. So we did quite a lot of learning. Those are our pilot projects. We haven't really done any transformation yet. This is our ambitious model for transformation. Integrated care in health education England in the West Midlands is one of five transformation themes. Those are all in light blue. We have to work together. We have to manage the interdependencies. We're all working together, however, on trying to change that mindset to bring about that shift in culture for working in an integrated way. We've put workforce planning, long-term system vision at the heart of what we do. That's one of our 4 priorities, which are now work streams. Those are the ones that are in salmon. And there's going to be more investment in the workforce at that frontline level around self-care and digital innovation. So I was asked to come up with 5 key messages. First one is that I think we've learnt from our pilot projects, which were really all workforce development projects, that they have very limited success if we only do them as workforce development projects. They have to be aligned much more closely with system leadership, and where we had system leadership and where we had some OD interventions, those workforce development initiatives have been more successful and have been more sustainable. So we need to align all of those things if we're to embed our new ways of working. One of the things we've just introduced is something called Leading Integrated Workforce Solutions. This is different to the standard system leadership programs. We're bringing together cohorts of staff working in localities on wicked workforce issues to work together as an action learning set. Second point, it's about definition of the workforce, which I think we've probably had a little bit of an attempt at today, but not come up with anything conclusive. This is the best that we can do, because it really is everyone, that paid, unpaid, informal carers. It actually includes skills development for people who use services for patients as well. We use this term workforce integration, which I also think can be quite misleading. We're not really talking here in most cases about formal changes, formal organisational or structural changes. What we're talking about is enabling everybody to work together in that integrated way. If we can hold on to that wider workforce definition as our starting point when we're designing training and development initiatives, I think we'll have a much better chance of delivering integrated care. And of course, because it is about working together, all of those things there around relationships, understanding perspectives, communications and trust, which have been mentioned several times today, all of those are crucial.
Julian, you've got 1 minute.
Okay. We need to move to integrated system workforce planning across health and social care economies that reflect the new models of care that we've heard about today. So we're starting to do some work with the MCPs and the PACs in the West Midlands. We'll move on to urgent and emergency as well. You may be aware of work that was done with Skills for Health here in North Central East London between Whittington Health Trust and Islington. Challenge really is aligning what we do with Commissioner priorities and plans, and Commissioners don't always see workforce as a priority, so we need to offer some help in doing some scenario planning to help to articulate that vision for the workforce. Health Education England North West are working with Yvonne and colleagues, as you've already heard. A couple more things then. Those are the challenges of integrated system workforce planning. In terms of workforce redesign, that's quite a useful model. Hopefully some of you have seen that before. If not, please take it away and use it. That's useful in terms of roles, but I actually think we need to be focusing more on skills and competencies, identifying which of those are needed for integrated working and making sure that those skills and competencies are based on outcomes. We're doing more work around care coordination and navigation skills, doing some work with the World Health Organization, who have a competency framework which we're going to be using and helping to develop. And there are other areas there where I think we need to focus on supporting workforce transition from acute to community settings, and we can do more to look at apprenticeships across health, social care and elsewhere. That's one model that's quite useful as a framework for principles and functions. Final message is around learning and development. So what we've learned is that if we can learn more together, if we can create those opportunities for networking, for multi-professional training, for job rotation, they have real benefits. And we're working with HEIs and other providers to expand multi-professional learning opportunities. Part of that could be a common foundation, but it also needs to be picked up as CPD. So, in conclusion, I work in an HR office. HR practitioners often say to me, oh yeah, your job sounds interesting, but what does that mean for me in practical terms? And sometimes it's quite difficult to translate, but I think in terms of the HR business partner role, it's less about terms and conditions, it's less about moving to new organisational structures, it is about those cultural things, changing the way we work. It's a need for OD intervention, and then I think from a learning and development specialist point of view, if you could, those of you who are here, take away that need for creating those shared opportunities for learning. Those are my contact details. There is a journal article coming up in the Institute of Ageing and Health, and there's also a blog that I did with Skills for Health and Skills for Care, which has been put on the Guardian website, which you can access from this presentation. Thank you very much.
Thank you very much.